All right, welcome. Hello, Facebook world. Thank you so much for joining us today. I am really jazzed about this topic. Today, we're talking about yoga therapy. This is one of the most common questions that I'm hearing discussed in online groups, in my networking events. Every yoga teacher out there, it seems, is interested in yoga therapy, what it is, and how it's different than just being a yoga teacher offering private sessions. So today I brought on my friend Angie Noe to help describe, a yoga therapist, to help describe what is yoga therapy. So let me first introduce Angie. Angie is a fun-loving human being who has a heart and a passion for helping and serving others. She is a native to Colorado, and her passion is to help others in all stages of their life. As a yoga therapist, Angie has completed over 2,100 hours of training in yoga and yoga therapy with esteemed teachers like Hansa Knox and Nishala Joy Devi. She adapts yoga practices to the needs of the individuals for specific issues that cannot be addressed in a traditional yoga class. And just so you know, Angie was asked to be an assistant to Nishala Joy Devi in July of 2015 for a Yoga of the Heart program in West Virginia in Yogaville. What an amazing experience it was for her to help her teacher and to be of service. And Nishala gave Angie a spiritual name of Anandi, which was received with both love and gratitude. So you may hear me go back and forth between an Angie and Anandi because I usually call her Anandi. So just so everyone knows. So thank you so much for being here today, Anandi.
Thank you, Allison, for having me.
Yeah, so I really just kind of want to dive into the biggest question that I hear and that I had before I started my yoga therapy training is, what is yoga therapy and what is the difference between a yoga therapist and a yoga teacher offering private sessions?
Okay. Well, yoga therapy is where we take a look at an individual and we work with them body, mind, and soul, and we come up with specific yoga tools to work with them to have a certain outcome. And so what that looks like is if somebody had insomnia, we would work with them with their breath, maybe giving them some postures, and maybe even doing some guided meditation to help them with that. So we're just taking and incorporating a lot of different tools. Did that answer that?
Well, what would stop just a yoga teacher who offers private sessions maybe for insomnia? What would be the difference between that yoga teacher and that yoga therapist?
Okay. So to become a yoga therapist, you need to graduate from an accredited school. And that's IAYT has set the standards for those schools to be accredited. So there's specific standards so that you can call yourself a yoga therapist. So it's more education. So a yoga therapist has more education. Another thing is a yoga therapist does is we do a intake form. So we get the history and the background of our person that we're working with. So we have a true understanding of what's going on with them. And so just then from a yoga teacher, they might help someone develop their practice versus working on a specific issue or disease or mood disorder.
Gotcha. So a yoga teacher is going to help maybe not with one specific ailment or issue, but in your opinion, they work more with an overall type practice, whereas
Right.
yoga therapist tends to work on one specific issue.
Yeah.
Okay.
Exactly.
Okay. You know, one of the things that struck me as being different about yoga therapy versus yoga teachers is that intake form too. I think you brought that up. I thought that intake form was really important because I know you've even mentioned how as a yoga therapist, you've been required to submit some SOAP notes or some notes about your clients, maybe from an accident or an injury or to lawyers. You've been asked to submit some of those items because as a yoga therapist, you're working with them on that specific issue.
Right. Yeah. So this was a scenario where someone was in an accident and they had, neck issues and spinal issues. And so she seeked me out to help her, because she knew I was a yoga therapist, to help her heal herself. And so her attorney called me and wanted the SOAP notes for those 6 months that I was working with that person. And in those notes was kind of described what we did, how long we worked, if there's progress, if there is no progress, how that patient or client was feeling at that time compared to when they first came in. So it's a really good measurable tool that a yoga therapist do have, that we do make documentation, and a yoga teacher might not do that type of documentation.
Gotcha. Okay. So you mentioned that yoga therapists have a lot more training. What does it take to become a yoga therapist? How much more training do they have than just a normal yoga teacher?
Well, I mean, there's different variations, right, of yoga teachers. So you have a 200, 300, 500, right? Whereas for myself, I have way beyond that. Plus I have almost 1,800 hours of yoga therapy training.
Gotcha.
So it is a measurable amount. I think that most schools offer like a 1,200 hour yoga therapy program. But what we have to remember is if they are looking for a yoga therapy program, it needs to be accredited through IAYT. So it needs to have the certain standards and the specifications that they need, so that once you finish that program, you can call yourself a yoga therapist. Sometimes you hear, oh, come to this workshop, a month workshop every weekend, and by the end you can call yourself a yoga therapist. Well, that's technically not really true, because to be a real yoga therapist, you need to go to an accredited school, you need to graduate, you need to meet all the requirements that are for that yoga therapist. And you also need to see clients over, I think it's 50 some hours of yoga therapy clients to submit so that you can graduate.
Yeah. So IAYT, just so everyone knows, IAYT stands for International Association of Yoga Therapists, and they are basically the organizing body over yoga therapists. Think Yoga Alliance, but a lot more professional, and they really have your back on a lot of issues. And so IAYT, you want to make sure that you're choosing a program that is IAYT certified and accredited. And I believe the minimum requirements are 875 hours with like 50 hours of one-on-ones with clients. So it's quite high. And before you go into that yoga therapy certification, I think you have to have your 200 or maybe even
500.
You have to have your 500 hour. So as a yoga therapist, you really have a lot more tools in your toolbox than just going through my yoga therapy program, I have so many more tools in my yoga toolbox than I ever received in 500 hours of training. I mean, it's just been really incredible. So, okay. So what is the scope of a yoga therapist? What are some types of clients that yoga therapists may work with?
Okay. First of all, I would like to say that as a yoga therapist, you never diagnose anybody. So that's the first and foremost. And that yoga therapy is an additional I'm losing the word for it, modality to have for yourself. And so the scope of a yoga therapist, depends on if you have a niche that you want, or if you're working with all kinds of different situations. So just to give you some ideas, a yoga therapist can work with pre and post-op surgery, injuries, accidents, Parkinson's, arthritis, moods like anxiety or depression, bipolar, MS. The list can kind of just keep going on and on. Yes, we can work with also structural issues, lifestyle changes we can work with to help suggest different lifestyle changes. The list can go on and on. I've worked with people with balance issues, insomnia, um, scoliosis. So the scope is just like really broad, but you can also hone in on that if you'd like to become like a specialist in, grief or Parkinson's or whatever, pelvic floor health,
So it's really, yoga therapists can work with physical, mental, emotional, and even spiritual issues.
Yes.
Really.
Yes.
Yeah, because your toolbox is just so much bigger. Yeah. Okay. That's helpful. So in your opinion, what do you think is the difference between yoga therapy and physical therapy?
In my opinion, I feel like the physical therapy, they just work one side of the body. Let's say you had a shoulder issue. They would just work that shoulder. Whereas yoga therapy, we incorporate the whole body. We look at the body, the mind, and the soul. And so we just don't work the right side, we work the left side together, and then we work the whole body. Kind of like when I've done helped with teacher assistants in yoga therapy program. It's like, okay, we might have a shoulder issue, but we need to look up above and below, because if we can address those areas, then maybe the shoulder will just correct itself. Or if there's a pain, you want to make sure you look at the whole thing, but also address the whole body.
Yeah. Okay. So looking at the whole person, because we're more than just this body, we're more than just this physical thing. Our mental state affects our body, our emotional state affects our body, our spirit affects this human suit. So looking at the whole person versus physical therapy is just physical.
Yeah.
So, exactly. and a lot of times with insurance, I know whenever I had my hip surgery with insurance, they could really only work my hip.
Yep.
So I was like, yeah, but my low back hurts too. And she's like, okay, I'll do a little bit there, but she wasn't really supposed to,
exactly.
For insurance on her document, it was just work to the hip. So
yeah, and most times if you address that in a physical or yoga therapy session, if someone comes in and you were normally seeing them for their shoulder or their hip, they say, oh, my back has been killing me. Well, you could maybe address those certain things, and it might lessen the discomfort or whatever in the shoulder or the hip. So, yeah.
Perfect. So who do you think should consider being a yoga therapist? It is a big time commitment and monetary commitment to become a yoga therapist. So in your opinion, who do you think should be a yoga therapist?
Well, I think anybody that wants to go beyond being a yoga teacher and wants to be able to help people heal on many different levels. And for myself, I loved what yoga had done for me mentally and physically. And then I was like, man, there's so much more to this than just being a teacher. And so that's why I was exploring and had done Remia's program and finished Hanzo's program, because there was so much more. And I was just like a sponge wanting to learn, to help, so I could facilitate others on their healing journey.
Gotcha. So you really want to work more one-on-one with people. And it sounds like you even were able to deepen your own experience and your own practice as well.
Exactly.
Yeah. I can speak to why I have personally been seeking yoga therapy, and or my yoga therapy training. And there's two main reasons. One is I really wanted to just keep learning. I wanted a deeper dive. I wanted more of those tools in my toolbox so I could help others as well as help myself. So that was a big part. And I really think, this is my own belief, I really think that if you are looking to be in the yoga industry and make this your career, yoga therapy is going to be that more professional level where you can work in hospitals, you can work more in rehabilitation programs, you can work in prisons, you can work with more special populations. And so for me, I hope I'm in this career, in this industry for another 40 years. Well, no, I don't want to work for another 40 years. I want to retire at some point, but I want to continue in this industry. And I knew that I would need to take that next step, that next level of professionalism. So if it's something that you're looking at, there's always a talk of maybe yoga therapy will use insurance at some point, or
Exactly.
insurance will use yoga therapy. I know that's a hot topic, but within the next 30 years, there's a pretty good chance we're going to see some major changes. And I think yoga therapy is going to be at the forefront of that. So that's my opinion on who should be a yoga therapist. Someone who's really looking for that kind of career move and to really help others.
Yeah.
So
I think that's what basically it boils down to, is being able to help others
mm-hmm.
and provide tools to help them heal whatever level they need to.
Yeah.
Mm-hmm.
Yeah. It's that next step on the professional or the career path. As a yoga teacher, you could be just a yoga teacher. You can own a studio, you can train teachers, and yoga therapy is really helping you help others, work with privates and special populations, which is such meaningful work. It's pretty awesome.
Oh, it's amazing. I absolutely love it.
Yeah. So what are some of the clients that you've worked with before?
Oh, I've worked with arthritis, rheumatoid arthritis clients. I've worked with the older population to help them keep their mobility, their flexibility, balance issues. I've worked with Parkinson's people. I've worked with post and pre-cancer patients, mainly women who have had the mastectomy and is just reconstruction surgery, and helping them through that next phase that they're going through. Degeneration of the joints. I've worked with people with that. The list can keep going on and on. Also people who have sleeping disorders. What's really nice about the yoga therapy industry is when I see my clients, I always check in with them to see how they're doing, because I might have an idea what we would work on from the last time. But when you check in with your client, yoga therapists, they really need to listen. And I think that's just I would say that it's the most important thing in yoga therapy, is you've got to be able to listen, not just pretend like you're listening, but actively listening and being compassionate and being there for them. Because sometimes people just need to have that soundboard to share, this is how I'm feeling. And then if they share that, then you can take and make that protocol of what's going on. For instance, my Parkinson's person came to me and he's been saying, oh, my feet have really been bothering me. My hamstrings are really tight, but that was different than what I was going to do. So my class, or my session with him, was addressing his feet and his hamstrings, but we also did deep breathing, and we also worked the whole body. So we just didn't work with the feet. So we also did some vibration and sounding tools to help with the Parkinson's, right? So it's just a beautiful field to go into, and it's something new, and it's something that's starting to get more popular and recognized. And, I think anybody who's wanting to take that next step, it would be a great place to go.
So in your 2,100 hours of training that you've had, I'm sure that you have this giant toolbox for yoga therapy. Can you just start listing off, besides just asana, which we all know asana is one of the tools, can you start naming some of the tools in your yoga therapy toolbox?
Sure. I did a whole, I called it my yoga therapy toolbox. And I did a whole presentation to some people that were studios that were looking at possibly doing their yoga therapy program. So yeah, I had this whole list of things and this whole presentation. So if you know of anybody that would like to have a presentation on yoga therapy, but let me start. So we have lifestyle changes, right? We of course have the asana, the pranayama, the mudra or hand positions that you can help people relieve some situations. We have meditation, we have guided meditation, we have self-inquiry, we have sounding, mantra, using the BG sounds. We have the marma points in the body to help stimulate those. We can also use color therapy, because if people wear certain colors, it makes them feel better. I've also used some aroma therapy to help someone's taste come back in Parkinson's. So we have a big scope of things to use, right? We can even do music. We can play music in our sessions to uplift people. So, I mean, the box can just keep going on and on and on. Of course, as a yoga therapist, you only want to practice the things that you are trained to do.
Mm-hmm. Mm-hmm.
So,
yeah. This past year, we learned some of the deities and how to bring those into a yoga therapy session. I thought that was really cool too, because I had never even thought about using them. So yeah, the box is insanely big. And I think finding a really good yoga therapy program that tries to address a lot of these is a really great place. And so, it's just like taking a 200-hour. 800 hours sounds like, oh, I'm going to know everything about yoga therapy at the end of this.
yeah, no.
There's still always more to learn, but try and find a program that's going to address all the things that are most important to you. Research all these tools and look at the programs and make sure that you like the teachers. Make sure that they're a reputable school. Make sure that they're certified by or accredited by IAYT. And just look at the tools that they're going to teach you, because Marma Points was like a completely new thing to me. And so I really wanted to make sure that was in my training. I have an Ayurveda portion in my training, which that has been
Joy Tish. I mean, I could probably continue to expand on that box, but it's just like right at first, it's like, these are the most prominent ones you're going to use. But yeah, you have Ayurveda and you have your Joy Tish and you have your, Vastu, which is like feng shui, right? So you have all of these things that you can bring into helping a person.
Yeah. And I have to say, as much as I've loved using them all for my clients, I really love using them myself.
Yeah, exactly.
So it's been really great. Awesome. Well, thank you so very much for answering a lot of my questions. I'm sure that our people are going to have so many more questions, because again, this is like a constantly talked about topic, it seems. And so I think that you hit on a lot of really good points that, if you want to become that, a yoga therapist is kind of that next step. You're going to be able to work with people with specific ailments. You're going to address the whole person, body, mind, and soul. And that to find a program, make sure it's accredited by IAYT. So, yeah. And I know yoga therapists work all over the place. They work in hospitals. They are that next step, I really feel like. So, excellent. Well, again, thank you so much, Anandi. I really appreciate you taking the time to chat with us today. So if any of you have questions, please feel free to ask in the comments. And I know Anandi has worked with yoga therapy and grief before, as well as patients with insomnia. And she has an amazing meditation CD to help people with insomnia so they can sleep better and wake up feeling refreshed in the morning. So I'll make sure that I include that link on the comments.
Thank you very much.
Yeah. All right. Well, thank you so much, Facebook world. I hope you all have a wonderful rest of your day. Bye.
Bye.